Hello, I'm Dr. Farrow. I'm a family medicine doctor with Beacon Medical Group in LaPorte, Indiana. Without getting into the specific numbers, we know that colon cancer is a problem. It causes a lot of medical problems. We call that morbidity, and death, we call that mortality, that could be avoided. We know that currently the incidence of colon cancer in the general population increases around 45 to 50 years old, which is why the current recommendation is for the person in the general population at average risk to start getting their colonoscopies at 45 years old. People who are at greater risk, in part, for example, because of family members who had colon cancer and had it at younger ages, it is recommended that they go and talk to their primary care provider about starting their screening at younger ages. Things such as, believe it or not, the general things we tell people about being healthier. So eating right, exercising regularly. Smoking is bad for almost everything, and certainly increases the risk of multiple types of cancers above and beyond lung cancer. Eating a healthier diet that is lower in sugars, simple sugars, think sweets. Eating a diet that is low in saturated fats. Once again, we're basically talking about junk food, the good stuff, the stuff that tastes good. Okay, it has been found that Mediterranean diet, people that follow and eat and consume a Mediterranean diet for all of their lives tend to have a lower incidence of colon cancer, and possibly later in life. It does not mean that colon cancer does not happen in that population, but it tends to be seen at much lower numbers than in, for example, the average United States of America population. We are, unfortunately, the most obese country in the world. Within that, I believe, and I think it's been shown, is a higher incidence or higher potential incidence of colon cancer and other digestive system problems. I have a frank conversation with them. Most patients, when they say they're concerned about colonoscopy, scared about colonoscopy, heard bad things about colonoscopy, when I sit down and talk with them and get the details, almost everybody's talking about the prep, not the colonoscopy. Most people who've had a colonoscopy will tell you they don't even remember the colonoscopy. Okay, when you get the colonoscopy, the anesthesiologist does something which I call twilighting, right? You're not under general anesthesia, nothing's down your throat, but pretty much they say hello to you, start the medication in the IV, and then wake you up and you look up and the colonoscopy is done and it's an hour later. I like to tell people, which doesn't ease their mind a whole lot, that the prep used to be 3 days long. Now the prep is about a day and a half. Health screening such as colonoscopy, such as mammograms, such as pap smears, looking for various kinds of cancer, and actually, frankly, hopefully finding the precursors to the cancers so that we help the person before the frank cancer develops, are based upon incidence of those cancers happening in the general population if you do nothing. So I cannot sit with a patient and tell him or her that this particular cancer is definitely going to happen to them. We're looking at many studies over large populations and pooling of the studies so that the population is even larger when we're looking at incidence of breast cancer, incidence of cervical cancer, incidence of colon cancer. Cancer can happen to anybody of appropriate gender if they live long enough. And what our job is to say to all of our patients that this is what we see, this is what has been shown over years and years and years, this is what you're at risk of that we could actually prevent. And screening everybody in this age group for this particular cancer is likely to decrease that mortality and morbidity that I talked about significantly, simply because we screened them and did something before there was cancer present. And if there's cancer present, because we caught it in early stages rather than late stages.